Dengue fever is this is a definition. Definition is the acute viral infection transmitted by the Aedes aegypti mosquito characterized by the saddles, back and high fever, intense headache, body ache and rash, generalized in the lymphadenopathy and the hemorrhage. Clinical feature clinical feature dengue break bone fever. Symptoms: first symptoms, onset abrupt fever, high fever with a chill, severe distressing pain justify the name breakbone fever. Location: several frontal head edge over eye. Ball erectroauricularis, pain, back and loins, limbs, joint, and aggravation moment turning in the bed, distressing joint and the muscles pain, intestine prostration, noxia, crasia, and lampration, and delirium and eruption appear on the fourth and sixth day with the second weeks of the fever. Despair in the order and there appear by scaly desmation, urine scanty and the high cholera. साइन की बात करते हैं. साइन पोस्टेड में रेस्टलेस होगा, फेशियल्स में एनोक्सिया एंड आई होगा ऑन कॉन्जेस्टेड एंड आँख के पीछे दर्द करना. ठीक है. एंड बता दूं कि टंग से होगा कोटेड येलो वाइट, मतलब बीच बाल होगा कोटेड, मतलब वाइट कलर दिखेगा. ठीक है. सर्वाइकल लैम्प एंड द ग्लैंड ऑफ्टन इन लार्ज. टेम्परेचर basic saddles, back pattern, sudden onset of fever which remained high 1 to 103 degrees Celsius Fahrenheit to 105 Fahrenheit. First 2 of 3 days of the fluid of the gradual decline of the temperature, which against the suddenly shoot up on the 4th or 5th day. This second rise is a flowing by a complete region by 2 day total duration of the fever and is 6 to 7 day. Respiratory क्या रहेगा? फास्ट रहेगा. पल्स रिलेटिव ब्रेडिकार्डिया, पल्स प्रेशर लो एंड रेस्टलेस. इसमें मेरे से 3 पॉइंट आता है. एक मैकुलो पेपुलर आएगा एंड अपेयर्स ऑन द 6th डे एंड डिस्पेयर आफ्टर द 3 to 5 डे. जनरलाइज लैम्फोडेपैथी, लीवर इनलार्ज, सॉफ्ट होगा, टेंडर. His capillary fragility test is positive. Summary: dengue fever is acute febrile illness of 2 to 7 day duration with 2 peaks, having the following manifestation: sudden onset, continuous fever, and 2 or more the following festival, several headaches, orbital pain, several malaise, arthralgia, back pain, hemorrhagic manifestation and leukopenia, and high index of the suspicions based on the period, population and the place, and absence of the conventional evidence of any other febrile islands. Complication में टू पॉइंट होगा. पहला हाइपरेक्सिया एंड सेवरल हेमरेज. डेंगू हेमरेज ए फीवर. Dengue hemorrhage fever is the acute of the between dengue fever and the dengue hemorrhage. Fever is the evidence of the plasma leakage which will not be the present is in the former but in variables in the latter. This important in differentiations Dengue fever is the hemorrhage form of the dengue hemorrhage fever. Symptoms symptoms बता दूं onset abrupt रहेगा high fever with a chill and distension joint muscles pain intestinal prostration होगा epistaxis bleeding from the gums हेमेटेमेसिस होगा एमेलियाना साइन में क्या होगा साइन में फेसियस सन कैंस कोल्ड एक्सट्रेमिटेड रिस्पिरेशन हैरियल स्वेलिंग पल्स में फास्ट थ्रेडी एंड ब्लड प्रेशर लो जनरलाइज लैम्फोहेडेनोपैथी पे चीज पर पूरा लीवर इन लार्ज लीवर में बात करते हैं लीवर में देखा जाता है जैसे कि इन लार्ज होगा लार्जेड सॉफ्ट टेंडर ठीक है his capillary in the very fragility of taste. Positive is the performed by the inflating blood pressure acute to the point between systole and the diastolic pressure for 5 minutes. A test is considered positive when 10 or more pictures per 2.5 centimeter in 2 inch are the observed in the dengue hemorrhagic fever. The test is usually given in the definition positive result patches. The test might be negative or mildly positive during the phase of the profound shock. Dengue shock syndrome summary. Dengue hemorrhagic fever is a problem manifestation of the dengue syndrome with hemorrhagic manifestation having the following feature of the dengue fever at initial stage hemorrhagic manifestation evidence throughout on or more of the following. 3 step positive tourniquet test patches ichthyosis या purpura muscular bleeding epistaxis gums bleeding bleeding from the injection of the other site hematasis melena hematuria PV bleeding and thrombocytopenia with the platelet 1000 of the less and evidence of the plasma leakage due to in the cracks capillary permeability and manifested by on or the for the flowing 3 stage a 20% risk in the hemorrhagis of the age of sex and 20% drop in the hematocrit flowing treatment with the fluid and the compared to the baseline basic line and third point in the pleuria infusion acetate hypotensinemia बता दो then the complication that the dengue shock syndrome and the dengue shock syndrome and बता दूं कि dengue shock syndrome is a presentation of the dengue syndrome when a case of the dengue hemorrhagic syndrome manifests circulatory failure with one or more of the following feature hypotension of the age cold clammy skin restlessness rapid weak pulse narrow pulse pressure 20 of the Hg profound shock note grade 3 and 5 4 are also called dengue shock syndrome DDS इन्वेस्टिगेशन इन्विटेशन ब्लड CBSC TLC में देखेंगे लेकोपेनिया DLC में देखेंगे रिलेटिव लैम्फोसाइटिस प्लेटलेट लो लेस देन 100,000 comes in the no centration, hemorrhagics increase by 20%. Albumin level low, serology, viral isolation. Note on the clinically supported leukocyte and the platelet count. Pulse hematocrit level should be the don't at least on per day. Prognosis guarded miasmatic clavit, acute requirement miasmatic disorder. Therapeutic aims to cure, to prevent complication, to prevent spread. General management to bed rest, antipyretics therapy of 4 fever at 39 degrees Celsius. Cold spawning during fever. Food according to the appetite in prepares fresh fruit, juice, liquid, well balanced and easily digestible diet. Advice community cereals available of the fruit juice because the contains preservatives. Early rehydration therapeutic whether are it equals lesson or if patient develop moderate dehydration due to the vomiting and high fever. Relief of the pain. IVF replacement of the fluid and the electrolyte platelet transfusion in the hemorrhage. Management of the dengue fever, uh, DHF, DSS. Management of the dengue fever, DHF, DDS. Do for doctor suspected dengue fever in case of the fever of the sort, duration with the redness of face, race in the congested eye and body itch after rulings out their infection. Investigation all much patient for the TLC, DLC and platelet count and hematitics and PCV. Report all the such patient with the bleeding in manifestation from any side of the thrombocytopenia to the death outright MCT. Manage this patient with cold spawning, load of the fluid and juice. Allopathic can prescribe paracetamol. All the patient with the platelet counts 1 lakhs or the bleeding of hot 36.4 or the tourniquet test positive might be the reference to the nearly hospital for the future of further management. Don't use the aspiration, it is the patient is using aspiration. And बता दूं एंटीबायोटिक स्टेरॉयड हैज नो रोल इन द ट्रीटमेंट ऑफ डेंगू. Don't use IV fluid indiscriminately if it is the fluid overload. Treat the bleeding manifestation and note the platelet count, and the platelet count has no direct correlation with the bleeding manifestation. Don't use false blood transfusion or platelet concentration indiscriminately as they have got limited role the routine management of such case. Guidance for the indoor patient. The all patient with the DHF without bleeding can be the overs and managed with a lot of the fluid like only patient with the recent hot blooding manifestation or and the evidence of plasma leakage associate of the pulmonary effusion and the narrow plus pre- pressure 20 mmHg. Shock should be the admitted and put on the IV fluid. Ringer lactate normal saline or 0.5 0.45 ml normal saline are the internal fluid of the management of the HDHF oblique DDS case. In case of cause of no response to stratolide with 2 and 4 hours of remaining shock patient shift to the colloid dextrox 40 who blood transfusion is to be given only in the case of the miasmic bleeding leading to the failing hematite levels providence patient is not fluid overload. Platelet concentration are the required only if in the platelet level of the below 10,000 per cum. All shock the patient should be the managed on the guideline of the shock. A, a febrile phase dengue fever constitutional symptoms in symptoms with the DF after the fall of the fever are the similar during the feveric phase. Most patients will the recovery without complication. The following manifestation might be the present. 3 point improvement in the general condition. 2. Platelet hemotic normal and aptetics rapidly regions. Management is more or less some continuous bed rest, cheek platelet and the hemotic orally. Fruit juice are orally fluid and the electrolyte therapy. Convals- Convalescence phase dengue fever. The duration of the convalescence phase in the 7 to 10 day after the febrile phase. During this phase, further improvement in the general condition and return of the appetite occur bradycardia and confuse petechial rest with the white central end of the itching. My persist weakness may remain up to the another week for to no special advice is necessary also no restriction is needed normal diet and the effort for the adjusting to normal lifestyle and work are necessary. Prophylactic measurement में 3 point use of the mosquito repellents protects clothing and bed net. 3. Environment sensation and 3. Intermittence during dying of the water store. Medicine is a conite and brania, epotorium, and gelsemium. This is a medicine is a sign, symptoms, and doctor advice prove that for the use. Thank you. Bye. Jai Hind, Jai Bharat.